Immunotherapy is probably the most exciting thing going on in medical oncology today. There's several types of immunotherapy, and one type is a vaccine. So vaccines are basically taking a tiny amount of a protein that's expressed on a breast cancer cell in combination with medications that stimulate the immune system. So that, similar to the way we undergo vaccinations to prevent infection, giving these tiny amount of protein allows the patient's body to mount an immune response to those cells and recognize those cells as different from normal cells. So we currently are excited that we have 3 vaccine trials open at the Dubin Center for several different subtypes of breast cancer. And these are for patients with early stage disease. After they complete all of the standard therapy, we're able to offer these vaccines. So we have a vaccine for patients who have what's called triple-negative breast cancer, where they don't have any of the hormone receptors or the HER2 protein. And we also have vaccine trials open for patients who have HER2 neu positive and HER2 neu negative breast cancer. And we're the only site in Manhattan that has these vaccine trials, and so we're putting lots of patients on the trial. We're very excited about this. The other important type of immunotherapy to mention that have been in the news a lot lately are what are called checkpoint inhibitors. And basically, at this point in time, those drugs are being looked at in more advanced cancer, but the way things work in oncology in general, if things are found to be effective in advanced cancer, we then move them into earlier stage disease. So what checkpoint inhibitors are is that the cancer cells actually tell the body to shut down the immune system so that the patient's own immune system can't recognize those cells as different from normal cells. And what these checkpoint inhibitors do is they allow the body to release that molecular brake that the cancer puts on the immune system. So they inhibit that shutting down of the immune system and are able to unleash the patient's own immune system to fight the cancer cells. And these are amazing drugs. They're currently FDA approved in advanced lung, lymphoma, bladder, kidney cancer. There's some early evidence in certain types of breast cancer that these drugs have effects as well, and so those are in clinical trials. These drugs are able to produce sometimes durable remissions in patients who really are not responding to other therapies, unlike things that we've seen, for example, melanoma, which used to be an absolutely devastating advanced melanoma. Patients now go into remissions that last for many years with these drugs. We're excited to find out that we just got funding for a study combining chemotherapy with one of these checkpoint inhibitors in patients with advanced breast cancer, so we'll be opening that soon.